I've had Juvederm Voluma and the softer type put in my face. Can I mix other types or should I stick with one brand? I had my cheeks, lips, smile lines all done in December, January this year. I'm so impressed, except the doctor sucked at the smile lines and admitted he didn't like doing them. I'm so happy with the rest. I want my hollow eyes done and maybe more in my cheeks and lip. I see many salons near me using different brands. Can I get another type or do I need to stick with what's already there? I don't want to create any problems.
Thank you for your question. You submitted your question with two photos, and you state that you, several months ago, underwent filler correction with Juvederm in the cheeks, the lips, as well as in the smile lines. And you state that you were happy with the cheeks and the lips, but with the smile lines you were not so happy, and your doctor stated to you that they don't really like doing the smile lines. Now you're concerned about doing under eye hollows, and you have perceived or become aware that in salons near you that different brands of fillers are offered. So your question is essentially about changing brands or whether to stick to one brand. Well, I can share with you my personal philosophy about fillers and the placement and as well as this ongoing perception about brand identities that are relevant to correction of different issues in the face. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I have literally been a part of the evolution of the use of fillers since the very early days where there was only the collagen, Zyderm and Zyplast, and since then I've certainly become very well known for the use of fillers, particularly in the Juvederm and Restylane families. And I can give you basically an overall understanding of how I approach these areas and how I would suggest you what to do moving forward. So to begin with, I think it's very important for everyone who is interested in having fillers done to make some specific distinctions. Essentially, fillers, like pharmaceuticals, are produced and promoted by multi-billion-dollar companies. And it's in their interest to create consumer demand for their product. But the product is not worth anything unless it is placed properly by a skilled practitioner. And so when you think about the differentiation between the United States and other areas of the world, the menu of fillers varies, and yet there are many skilled practitioners able to get consistent results with limited numbers or with a large number of fillers. So how is that possible? Well, I'll tell you that as far as the brands are concerned, there is a spectrum of the behaviors and particular characteristics of the fillers in the Juvederm family as well as in the Restylane family, which are both hyaluronic acid fillers. And there are differentiations based on their relative thickness, their elasticity, their longevity, and based on your doctor's comfort level and familiarity, doctors choose what they prefer. Now, that being said, I think what you can reasonably conclude about your experience with your doctor in terms of the cheeks and the lips and the smile lines is that specifically with the smile lines and nasolabial folds, this is an area that I think most doctors either would confess that the nasolabial fold is not as so easy to treat And that has to do with the anatomic nature of that area. And rarely can you get 100% correction because you're treating a line as opposed to structure. And speaking of structure, in our practice, we do a procedure called structural volumizing. And so, in people who have issues with their nasolabial fold, very often when I restore volume by placing the filler at the bone level to improve the cheeks in a way that is more directly integrated with the bone structure, then the nasolabial fold doesn't look as prominent or as deep. And that is the art of sculpting, of creating this balance. Now, that being said, now separating that from the different fillers, I would say that if you are really interested in getting consistency, then you should identify a practitioner who is skilled in using different fillers and is able to establish for you the outcomes that you are looking for, at least close to achieving. I would dissuade you from going to what sounds like whether salons are like hair salons versus medi spas. A lot of times these places don't have either doctors, at least in the United States, don't have physicians who are present, or their model is more of a volume discounting model, and very often patients just bounce from one to another instead of finding the right doctor who can offer them the solutions and the long-term relationship that really ultimately is more productive and has results in better consistency, as well as in the end actually is more cost effective instead of bargain shopping, which is something that happens certainly in the US. With that being understood, I would say differentiate the product away from the practitioner and the method of placement. That technique and the practitioner's style is very, very important. And especially when it comes to treating the area that you're concerned about, the under eye hollow area. Getting that area just right and having the best result is really an art, and I think that you will find that if you find the right doctor who can help you with all those areas, that you'll want to stick to the doctor as opposed to chasing the brands. The brand does not produce the result. It's the doctor who performs the procedure. And the art of this is for the doctor to choose the right products that are suited for each area based on their experience. And so it's a balance, and it's important. And of course, doctors don't promote the way the companies do, but at least the consumers become aware of what's available, and certainly there is a value there. So either go back to the doctor that you already had the experience with, or look for a doctor who you feel will be able to be comfortable with doing all these different procedures, and that way you can at least go to someone for some consistency and get consistent results. I hope that was helpful. I wish you the best of luck, and thank you for your question.